Anne decided to take her baby Luke to the pediatrician after she realized that her baby was not babbling, gesturing, waving, or pointing like other babies his age. After utilizing the MCHAT checklist for toddlers, the ASQ Autism Spectrum Quotient, and the Denver-2 Developmental Screening Test, the pediatrician suspected Luke to be experiencing symptoms of autism spectrum disorder. Luke's deficits in social and emotional interplay, his lack for nonverbal communication, his delay in understanding and developing relationships with other humans, and his repetitive actions fit the DSM-5 criteria for autism spectrum disorder. The pediatrician suggested that Luke see a naturopathic doctor to help reduce and manage Luke's autistic symptoms. I brought Luke to see the naturopathic doctor the following day. As a recent graduate, the ND wasn't entirely familiar how to treat and manage autism, so he decided to do some research before prescribing anything for Luke. The following week, Anne and Luke returned to follow up with the ND, and the ND presented them with some research. Dr. Donald, the ND, first highlighted the importance of changing Luke's diet to be gluten and dairy-free. Many children with autism have been found to have poor digestive health and food sensitivities. Elimination of offending foods have been reported to be some of the most powerful treatments for autism spectrum disorder. Many research studies have demonstrated that when parents are strict with diet restrictions such as gluten and casein, there is a significant corresponding improvement in autism-like and social-like behaviors, as well as physiological symptoms. A systematic review performed in 2010 concluded that gluten and casein-free diets should also be implemented in children with autism when the child demonstrates acute behavioral changes associated with the elimination of those foods, or if the child has been officially diagnosed with allergies or intolerances in the two food groups. Dr. Donald therefore suggested that Anne first try to eliminate gluten and casein from Luke's diet for 4 weeks and assess for any changes in his behavior and developmental delays. If at 4 weeks nothing has changed in Luke's behavior, there may not be a strict need for elimination of these foods in Luke's case. Next, Dr. Donald highlighted the importance of strengthening Luke's immune system, specifically at the level of the gut, as many children with autism experience gut dysbiosis. Observational studies investigating the connection between gut health and symptom severity in autism children have demonstrated that there is a strong linear positive correlation between autism severity and digestive dysfunction. Children with autism have been found to have lower amounts of short-chain fatty acids in their stool when compared to controls. Low levels of short-chain fatty acids are likely due to various factors, including lower fermentation by beneficial bacteria, lower intake of soluble fibers, prolonged transit times due to constipation, and/or increased absorption of short-chain fatty acids due to hyperpermeability within the gut. Dr. Donald found research to show that there is a statistically significant difference in nutritional and metabolic status of children with autism when compared to healthy controls. His research revealed that many children with autism suffer from a deficiency of vitamin D either during fetal development or early childhood, and that deficiency of vitamin D is strongly associated with autism severity. Because vitamin D plays an integral role in the development of brain size, shape, and ventricle volume, as well as gene regulation at the level of the gut, Dr. Donald suggested testing Luke's serum vitamin D levels. If they were low as suspected, supplementation of 400 IU per day is recommended. Dr. Donald also found that vitamin B6 has been demonstrated to be elevated in children with autism. This is thought to be due to a lack of pyridoxal kinase, the enzyme responsible for converting vitamin B6 into PLP, which is responsible for assisting the conversion of levodopa into dopamine. Without this conversion taking place optimally, social behaviors, communication, functioning can be negatively affected. A daily dose of 0.6 milligrams per kilogram of vitamin B6 has been shown to improve symptoms of autism. Studies have revealed that children with autism have significantly lower plasma levels of choline and betaine than healthy controls. Choline and betaine are important at metabolizing folate, and low levels of these two nutrients can negatively impact methylation and oxidative capacity in children with autism. Supplementation with choline at 250 milligrams per day and betaine at 1,000 milligrams per day have demonstrated to decrease symptom severity of autism in both children and adults. Brain levels of vitamin B12 have also demonstrated to be up to 3 times lower among children with autism when compared to controls. B12 plays a critical role in recycling folate as well as brain development, learning, and memory. When dosed at 75 micrograms per kilogram twice a week for 3 months, children with autism demonstrated improved communication, interpersonal, and coping skills, as well as their overall autism symptom severity ratings decreased significantly. Management of autism can be very extensive and challenging due to the various mechanisms involved in this diagnosis. In summary, Dr. Donald has decided to begin Luke's treatment plan focusing on the major factors prevalent in autism, including improving gastrointestinal health, addressing possible vitamin insufficiencies, and improving oxidative and methylation capabilities with the following.